Hi, my name is Kathryn Nelson. I'm a BSN student at Stanbridge University, and I was selected for the Lead California Community Engagement Student Fellowship of Fall of 2025. So for my fellowship, I partnered with West Anaheim Medical Center and completed 30 hours of service with the performance and quality team, with specifically following and being mentored by the directors of the infection control and patient quality management departments. So for infection control, my main responsibility was to do hand hygiene audits. And then the majority of my time was spent with patient quality management. And when I was assisting with that department, I was mainly doing quality questionnaires as well as just rounding on the patients and listening to anything that they wanted to share with me, whether it was positive or something that could have been improved upon during their hospital stay, and really just being someone that was there for them to listen to them and their loved ones as well, with anything that they were willing to share about their hospital stay. So, the most impactful thing that I am taking from my fellowship at West Anaheim is this model that was introduced to me, which is the GREAT model, which this is a picture of a document that was given to me by West Anaheim Medical Center. It's so GREAT stands for Greet, Relate, Educate, Ask, and Thank. And the reason this was so impactful to me is because I was partnering with patient quality management, and a majority of the concerns I noticed with patient quality were usually surrounding the area of being educated or being related to. Obviously, when we go into the room, we're going to want to greet our patients. We're going to want to relate to them, as that really shows a sense of empathy and meeting the patient where they're at when we relate to them and we show our active listening skills. And when we go to educate them, it's important to bridge the gap between what they already know about their diagnosis or any of the exams or tests that are being run on them, and then bridge the gap between what they know and maybe questions that they have, or just anything new that comes up. Um, then asking is, of course, just seeing if there's anything consistently coming in and seeing if there's anything that we can improve upon, asking if maybe they understood everything about their diagnosis or any examinations that will be going on while they're in the hospital. And then also asking if, there's anything you can do for them, sit with them, listen to them, and, therapeutically communicate with our patients. And then, of course, it's always important to thank our patients. Because they could choose any hospital in the area. And so the reason that this was so impactful to me during this fellowship is because I've always known that I wanted to be a nurse because I love people and I love helping people. But I think I learned a lot about communication with patients and educating patients in the hospital, and why it's so important to meet patients where they're at or their loved ones, to hear them, to see them, and then to, educate them, ask them if they're, you know, feeling comfortable, if there's anything that they can better be explained, or if they need extra time with a doctor or just even me as a nurse. Uh, the the piece of communication was something that I know that I'm passionate about, but this fellowship really highlighted that that piece is so important to me. I'm really passionate about patient overall outcomes and that they're leaving the hospital feeling like they were taken care of, that they were educated, they understand what's going on with them, and they feel prepared to go back out into society and, of course, do their follow-up appointments and whatever they need to do when they leave the hospital. But I'm very passionate about just overall success of patients once they come into the hospital and upon leaving. And I think this fellowship really highlighted how important communication, teamwork also. Teamwork is so important. Another, I think the second most impactful part of this fellowship that I learned is that, as a nurse and a nursing student, soon to be nurse, there's a lot of pieces of the puzzle that I'm aware of at the bedside, whether it be the nurse, the physical therapist, the occupational therapist, the physician, dietary, speech language pathologist. Those are a lot of the bedside pieces of the puzzle that go into the teamwork of ensuring positive patient outcomes. But what I really learned through this fellowship is that positive patient outcomes come from even behind the scenes, the people that are working in more administrative roles. They're just as important pieces of the team as the bedside staff as well. So I feel like that really impacted me, um, and just taught me how important healthcare as a team really is and prepared me for my future as a nurse. I'm really looking forward to using this information that I learned about myself and about the healthcare community and taking this information to apply to my future nursing career. I'm very thankful. Thank you, Lead California, for selecting me. I can't thank you enough for how much this opportunity has impacted both my education moving forward for the next few months before I graduate, and then, of course, my career as a nurse. So, thank you so much. And I also hope that you're enjoying your holidays and a happy new year to you guys in 2026. Thank you so much. And I hope you're having a great day.